I grew up in Cedar Woolley, Washington, and I walked to school.
About a decade ago, 50% of kids were getting to school by walking or biking, and today it's 13%.
When it comes to safety and healthy eating and academics, all of those things make a whole child.
That pick-up and drop-off congestion that we see a lot of times that creates a lot of safety hazards.
A lot of the infrastructure that's put in close to the school is very safe. But when you go outside the perimeters of the school, then it's almost like no one worries about it.
In a lot of the communities that we're at, people don't have the choice to walk or bike or use any active mode of transportation. We're working with 6 school districts in South King County. Each school district selected 3 schools. They're schools that have traditionally not gotten the same degree of infrastructure investment as other schools in our region.
The work we're doing at CPBW and the work that Feet First is doing, the Bicycle Alliance of Washington is doing, is that we're hoping to increase physical activity in children, primarily elementary school children.
A big part of what this program has tried to do is connect the schools and the districts and the city governments. One of the biggest priorities that comes out of it is that cities are increasingly looking for a healthy community, and the schools are also looking for healthy students.
Starting tomorrow on Thursday, we're going to begin our Walk to School Thursdays program.
My vision is to incorporate a walk to school program. We are doing this by having one day a week where we designate for students to be able to walk to school as a group.
We want to make sure that our streets are appropriate for walkers, for bikers, and for cars, and for transit, for everyone.
Who knows anything about this intersection? Can anyone tell me something about this intersection?
The purpose of a walking audit is to bring together people that are invested in a particular neighborhood or different community from all different perspectives, from the community members up to the elected officials. And we facilitate a conversation while we're walking around the neighborhood.
Using the information that we get from the walking audit, we help put together a walking map that shows where the best routes to school are for the kids, and then that can get distributed to parents so that they can help plan their kids' path to school. And then we can put together a plan so that even if there's not money available right now to make changes, we've got a plan lined up so that we can actually start making those improvements.
You got to get your groups of 3 so we can get ready to go.
Each school is holding an encouragement event, so that's like a walk to school day. It's just a chance to sort of entice people back on the streets to remember what it's like to walk to school. It's also to get people from the city to come out and walk from the school, and to get parents to do the walk to school, to actually physically experience what the walk is like. We've seen in other communities that schools that initially start off with a big one-time event where you walk to school have decided that they've gotten enough enthusiasm from the kids and the parents that they've tried doing it once a week. And then after that, they start doing it twice a week. And then at a certain point, it just becomes the norm that people want to walk to school together because it's an enjoyable activity. A big part of safe routes to schools and transportation in general is looking at the cultural shift that's happened in terms of how we get from place to place.
As soon as you start walking around, you get out of your car, you can immediately start understanding, oh, this isn't designed for me anymore. This is designed for me in my car, and there's a real difference.
Walking down here.
The huge barrier that we're facing when looking at shifting people's understanding is that we're trying to encourage people to walk and bike, but our environments that we've built don't actually accommodate for that.
What we try and get across to parents is that it's not safe to drive your kid to school because you're increasing their risk of physical inactivity and increasing their risk of diabetes and heart disease. And we know that countywide, obesity is one of the 2 leading causes of preventable death. What successful cities have done is to set up a Safe Routes to School committee. It's a chance for representatives from the district and representatives from the cities to actually sit down once or twice or maybe even more a year and talk about what the newest challenges are and what the newest opportunities are and identify ways that they can work together. By setting up that sort of a partnership, it really adds to the sustainability of the project.
Yeah.
In the elementary schools that we're working with alone, there's about 7,000 kids. And if you add in the middle school and high schools, then you're up to about 10,000 kids who could potentially be impacted through the work that we're doing. We'll have schools that have plans that are in place so that they can go out and find grant money and apply it. We'll have teachers across the county who've been trained on the best ways to teach their kids to be safer as they walk and bike to school. We'll have reached out to parents to help them know the tools to reinforce those lessons that the PE teachers are giving. And we'll have really made some strong connections between the city and the county, because it's an effort that really spans sectors.
Okay.
What's really inspiring about the project for me is to meet all these people who really want to make it better for the kids. They want to improve the kids' health, they want to improve the kids' safety around traffic, they want to improve the safety of the community.
Physical activity increases general health and well-being. Safe Routes to School is a way that we can encourage that school by school and then hopefully district by district to get kids to be able to walk to and from school and hopefully make those changes sort of broader.
One of the things that we are trying to do is to make equal opportunity for everyone in our city to be healthy, to be active.
It's number one thing is to keep kids active all the time. Healthy kids make happy kids, and it's as simple as that.